Hello, thank you for having me. Today, I will briefly talk about how and why does psychodrama work and explore trends in change process research. So let's dive in. First, my journey with change process research really took off in 2019 at the ECARTE conference in Spain, and it resulted in a scoping review publication with my colleagues that you can see here, from therapeutic factors to mechanisms of change in the creative arts therapies. So change process research basically is important for several reasons, for psychodrama and for arts therapies in general. One reason, it can help us to formulate our theory of change. How are we explaining change in a specific modality of treatment? To identify factors that explain the therapeutic change, can we pinpoint factors that take part in this process of change? Then, if we know those factors, we can improve the effectiveness of the intervention treatment. And finally, it can also help us develop more effective training and supervision strategies. The aim of our scoping review were first to clarify key concepts and definitions in the literature, because there were so many different uses in the literature of practically the same thing, and it could bring to a very confusing way of discussing things amongst our community members. Two, to identify the evidence from empirical studies on therapeutic factors and mechanisms of change, and I will explain the difference in a moment. To identify specific factors and joint factors across the creative arts therapies, and to identify gaps and offer methodological directions for future change process studies. So the first term I would like to clarify and share with you the way we phrased it is common factor. So common factor is essentially a change factor that is common to all forms of psychotherapy approaches, and therefore it is atheoretical. It is also known as non-specific or universal change factor. They can be located at the therapist, they can be located at the client, they can be located at the interaction between the therapist and the client, and they can be also external to the therapy session and setting. Quick examples that are also shown in our paper. Our therapist common factors involve empathy, warmth, positive regard, respect, acceptance, and so forth. Clients' common factors involve motivation, expectation of therapeutic success. That is a very significant predictor of therapeutic outcome. In the interaction factors, one of the most, or maybe the most empirically based factors is the therapeutic alliance or the therapeutic relationship, also called bond, rapport, and has to do with what happens between the therapist and the client from both perspectives, and sometimes even from an external perspective. And extra therapeutic factors, the environment, the support system that the client may have, life events, the community where the clients are, socioeconomic status, and other aspects. When we're talking about group therapy, there are, of course, common factors that Yalom has indicated, for example, altruism, universality, and others. So let's move on to another kind of factor that is called a specific factors. So a specific factor is actually a well-specified change factor theorized to produce therapeutic benefits in a specific psychotherapy approach, such as psychodrama or drama therapy, for example. Dramatic projection, dramatic engagement, and action insight. Joint factor refers to a change factor that is shared across the creative arts therapies disciplines: music therapy, art therapy, dance movement therapy, drama therapy, psychodrama, and bibliotherapy. For example, playfulness, symbolic expression, expression of nonverbal content, aesthetic experience, and so forth. So now I'd like to talk about mediators and moderators. The first concept is mediator. This term is used in the context of quantitative statistical analysis for intervening variable that is theorized to account for the causal relationship between two variables, such as X causes M that in turn causes Y. There needs to be a causal rationale, a causal relationship that is theoretically based. A mediator therefore clarifies how or why two or more variables are causally connected to each other. So, for example, in the left, we can see a simple mediation model with one mediator, and in the right, we can see a sequential mediation model with two or more mediators that account for the change between X and Y. In addition to mediator, we also encounter moderators in the literature. So a moderator is a term used in the context also of quantitative statistical analysis for a variable that is external to the treatment, that influences the direction or magnitude of the statistical relationship between the treatment and the outcome. It may strengthen, weaken, diminish, reverse the relationship between X and Y. Moderator helps us clarify when or for whom therapy leads to change, and is a term usually used in the context of quantitative statistical analysis, even though we've seen some studies or some publication when the term moderator was used in a qualitative study, which is somewhat confusing. So for example, in this model, gender, age group, treatment format, is it an individual treatment or a group treatment, or dose, is it once a week or twice a week, may moderate, may change the relationship between the alliance and the outcome, for example, or between the intervention and the outcome. That's a moderating variable. Taking this one step further, we are focusing now on mechanisms of change or change mechanism. So here, we're talking about a theory-driven causal change or sequence of events or processes, or a sequence of mediating variables that help us explain in greater detail than factors or mediator alone how or why therapeutic change occurs. So here we're talking about more elaborated explanation, really looking into the mechanism of how or why a certain treatment works. For example, think about how we can explain why a certain drug works the way it works. What are the active ingredients, which is another term that is used and borrowed from the medical field into the psychotherapy field, but I really support the use of change factors and mechanisms of change because they are more widely used in the psychotherapy context than active ingredients. So our scoping review resulted in 67 publications altogether. Of them, 13 included drama therapy and psychodrama. And I would like to focus on the concept of concretization. The term concretization comes from the verb to concretize, which means to make something concrete, specific, or definite. Another definition from the Oxford Dictionary is make concrete instead of abstract. So these are the dictionary definition of concretization. But when we're talking about psychotherapy, we're essentially talking about making the client's inner experience more concrete in terms of externalizing the experience from the inside outside, using body, using voice, in order to make this inner vague or maybe abstract, intangible experience, making it tangible, making it concrete so we can observe it and we can work with it. So at the theoretical level, Jacob Levy-Moreno view the roles that people have in their life as the concrete, tangible form that the self takes, and psychodrama as a method that concretizes intra and interpersonal experiences. At the practical level, Moreno referred to various techniques in psychodrama, including the role-playing, role reversal, the doubling, the statue, to make the protagonist issues concrete, tangible, and external, so we can explore them, play with them, and hopefully change something from the internal experience in the here and now. So a quick illustration, the case of Becca, pseudonym, she used the physical gesture of demonstrating her choking while sharing memories about her husband who passed away earlier that year. In this sense, the psychodrama sensed that there is a loaded experience, emotional experience that perhaps wanted to be externalized and concretized. So with the help of auxiliary egos, who are group members participating as supporting actors, the therapist invited Rebecca to transform the sense of choking into a symbolic scene as a statue. So she directed someone else who stood in for her to make this experience alive, externalized on the stage. Of course, everything with the consent of touch and with the consent of Rebecca moving forward. And then she really managed to observe herself from inside, role reversing with the double, playing herself, but also observing it from the outside, from the audience, and shifting this perspective eventually made her realize that her choking related to her traumatic experience or memory from her husband's last day at the hospital. And she felt she had things she didn't have a chance to tell him. Slowly, she managed to move the hands of the auxiliary ego and help them to release herself from these feelings of guilt of not having enough time. This idea of concretization was published by Aviv Gurshnir, my graduate student, and me in Frontiers in Psychology. Concretization is a mechanism of change in psychodrama, procedure, and benefits. But there is a more recent paper, Neurodynamics of Relational Aesthetics, Engagement in Creative Arts Therapies, that I've published with colleagues in Review of General Psychology, that really talks about integration of therapeutic factors of externalization and concretization, and other factors as well, with functional network configurations to support what is called, in cognitive neuroscience, predictive processing. So briefly, it talks about adjusting prediction error, that we are expecting something, but there is a mismatch between the prediction and what the actual input is. And this mismatch, when it's tackled in a therapeutic context, can facilitate what we call a corrective experience in the here and now, if we are addressing it and we're approaching it in a different way. And looking ahead in psychodrama research, one question is, in terms of practice, how do we use mechanism of change to inform the practice? What is missing from the practice? Question two, in terms of science, how do we develop our theories and methods to really examine, pinpoint those change factors or mechanisms of change? And finally, how do we shape our training programs in light of the findings that are emerging? Thank you very much for listening.